Dr. Yorker here again. I've heard your requests and it sounds like knees are what you guys are interested in. As some of you know, I have a knee injury from an accident. The exercises I'm going to show you today are 5 exercises that have a lot of detail but will help manage pain, prevent pain, and help strengthen the knee for support and stability. The most important thing is actually 4 rules of the knee that you should try never to break. They are: do not kneel on them with weight bearing. Do not lock your knees straight while weight bearing. And do not allow your knees to go below a 90-degree angle with weight bearing. And when bending your knees, do not allow your knees to go in front of your toes. These 5 exercises are going to help strengthen your knee and also instill those rules to become a permanent part of your day. The first one's going to be a squat. So what you're going to do is you're going to stand about shoulders width apart. I'm going to stand this way so you can see me from the side, because some of the most important features of this are 3 of the rules. One of them, while I'm standing here, my knees are not locked, meaning there's a slight bend in my knee the whole time. I'm not locking them backwards, okay? That allows me to keep all the strain and stress on the muscle and not on the joint itself. You're going to do a squat, and you can use your hands initially for balance, in which you're going to bend, making sure your knees stay behind your toes and do not go below a 90-degree angle. Then when you come back up, you're going to tighten your quadricep muscles, but do not lock your knees. If you find when you do this you feel like you're falling backwards, there's a beginner exercise that you do while sliding up and down the wall. But if you can do this with proper balance, and again you can use your hands for balance, just make sure your knees stay behind your toes and don't go deeper than 90 degrees, and don't lock them when you get to the top. That's exercise number 1. Exercise number 2 is to lie down. The feet are going to be flat and the toes touching. It's very important that while your knees are bent here, you're not too close and you're not too far away. The proper spot is going to be, while the knees are bent, to have your legs as straight as possible, but still being able to maintain your toes with full contact to the floor, table, or whatever surface you're doing the exercise on. Then what you're going to do for your exercise is you're going to stretch up as high as you possibly can, and then you come back down. And you do reps like that, as high as you possibly can. If you need a focus point, focus your attention on your inner knee. But you'll probably, most of you, feel it on the back here in the hamstrings. That's exercise number 2. Number 3 is to mobilize the knees. If you come in a little closer and actually see the knees here, all the way in, close in. What I want you to do is you're going to make sure your legs are loose, and then I'm going to actually gently move my kneecap side to side about 1/4 of an inch, and then up and down about 1/4 of an inch. Very important not to push straight down. You want to keep it floating, almost like you'd have a raft on water where it floats on the top. There's cartilage under that knee that you do not want to injure or put irritation in by pushing down. So you keep it floating on the top. It's just a little light mobilization side to side and up and down to make sure they don't lock up. If for some reason you find that you can't move them, it's probably due to the fact that your quads are tightening because your hip flexors are weak. In such a case, you'll put your back up against the wall, or if you have a partner doing them with you, put your back to back, go back to back, and actually allow your hip flexor to relax, will allow your quads to relax, and you'll be able to move the knees. And then the last 2 exercises take most of the time. You're going to lie down on your back. You'll have your hips at a 90-degree angle. You're going to squeeze your heels with an isometric contraction of the hamstring as tight as you can pull your heels towards your backside, like that. And you're going to hold it there for 3 breaths. Make sure you either toe up with both or toe down. Don't do one like that or one like that. They're either both down or both up. It doesn't really matter which you choose, whichever gives you the most tightening and intensity in the hamstring when you do the exercise. And then you hold it for 3 belly breaths, like I've shown you in previous exercises. So you pull in tight and then After you've done 3, you lock your knees completely. Now take note that I'm below a 90-degree angle here. And we just talked to you earlier about not going below a 90-degree angle with weight bearing. And I'm locking my knees. Take note that I'm locking my knees without weight bearing because we don't want to lose the ability of doing that. That's exercise number 4. And then the last exercise is to do the opposite isometric contraction of the quadriceps. You're going to tighten the quads, straightening your legs as hard as you can until you feel it on the inner knee, this part. So you're going to tighten them as hard as you can, and then you hold it there for 3 breaths. So each exercise should be started with 1 set of 5, eventually increasing it to 1 set of 10 and 1 set of 15. Very important, if any of these hurt, stop. Don't do it with pain. Call me at 215-351-1603 and I can go through things one-on-one with you. We could do telemedicine one-on-one with you. Just call that number and we'll set it up. Or you can email me at drscottyyorker@gmail.com. That's drscotyorker@gmail.com. Exercise those knees.